Hey, you guys, welcome back for another week of topics and tips. As promised, this week we're covering professional topics. This concludes our non clinical series for the month. And if you haven't had a moment, take a chance to go back and look at the past few weeks where we have covered all the topics. On Tuesdays we do our topics, Wednesday we work out those questions. And then on Thursday for this month, I have been doing a series to help you retain some of these terms by just repetitively studying. Because, I tell you guys, repetition is the key to retention, right? So if you are repetitively preparing appropriately, you're going to successfully retain what you should, right? So let's get into these professional topics because some of these terms get people kind of hung up. They overlap just enough to confuse you in certain testing questions. So I want to kind of give you a better way to look at it and hopefully help you to apply it for boards, okay? Hey y'all, so I always like to give my disclaimer before I get into my material. For those of you who watch my videos or have taken any of my review cards, hey you guys. And for those of you who are new here, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and founder and CEO of the Nursing Studio. My videos are designed to assist nurses and nurse practitioners with exam, board, success, as well as in practice, right? But I have to tell you guys, y'all know nothing in medicine is absolute. So these videos are not meant to be the end all be all. You still use your judgment, but this is just to guide you on that path for success, okay? So let's get into the terms. So starting off, here are a few terms again. These are very broad things that we know. And you know how you know something is so second nature, but they are overlapping just enough that you can slip up and make a careless mistake on boards. These are those terms. So I want to slow you down and pay attention to what makes them different. So the Board of Nursing, we know that the Board of Nursing is a state agency, and they're here to make sure that the nurses in their state are following and competent to provide nursing care to the public, right? So the Board of Nursing is the one who is ensuring that competency of the nurses in their state. Now, the State Nursing Practice Act is the actual law of the responsibilities of the nurse's scope of practice, and there may be slight variances state by state. Now, standards of practice is an overall standard of what responsibilities and scope that the nurses hold, but is under a broader umbrella, like the ANA provides that for all nurses. We know our standards of practice. This is what we follow, but the State Nursing Practice Act may have slight variances per state, but the scope is still the same, right? All right. So certification. Now, certification, we know, just like our nurse practitioner certification, right? This is something that comes from a non-governmental agency. So understand certification versus licensure. Certifications come from a non-governmental agency like the ANCC, the AAMP, that give that validity that we have met our qualifications in this clinical criteria to receive a certification as a family nurse practitioner, adult general nurse practitioner, etc., right? Whereas with the licensure, this is a state governmental agency like the Board of Nursing that we were just talking about, your state board. These are the people who provide and grant those licensures once you have met the requirements that fall under that scope of practice. Consultation. Now, again, these are terms that we know, but I want you to know how things may overlap so you can tell the difference. So, I want you to understand consultation versus collaboration. Now, consultation is when two people discuss and use their expert knowledge for the patient's improvement, typically, like for specialties that are consulted. So, someone who may have significant heart disease, you may consult cardiology, or anybody with significant respiratory disease, you may consult pulmonology, right? So you're consulting someone who is an expert to gain their knowledge so you can work together to improve that patient's care. Whereas collaboration, we are working together. So think of like a nurse practitioner and physician who collaborate with their patient for their patient's care um, alongside one another, right? Now, on to a kind of different topic. I like to throw in the health belief model because sometimes I do like to test on these levels of health style models. Health belief model is really what it says, and it's this psychological model showing that try to find an easy way to explain this to you. So it basically works to try to explain what may happen based on your behavior, but it's based on the patient's belief system. Because if you don't believe that smoking may cause lung disease, then why would you stop? You know what I mean? So the health belief model is, uh, again, that psychological model that is utilized and designed and looked at in a format with attempts to explain and predict the health behaviors of that particular population. All right. Now, sensitivity and specificity. So I try to break these down in the positive and negative format so that we can look at it. So I say sensitivity has the most T's, the letter T's in the word, and that is more positive. So sensitivity is the ability of a test to correctly identify those with the disease. Positive, right? So again, think it has the most T's in the word, so it's most positive. So it is more sensitive to have the ability of the test to correctly identify those with the actual disease. Whereas specificity has the ability of the test to correctly identify those without the disease. So I say negative for that, right? So it's more specific to determine those without it, where sensitivity is more sensitive to tell those with the disease. Now, leadership has a few dynamics. You know, there's a few leadership styles, but there's some areas that I want you to know about leadership. Now, when we think about leadership, I still want you to make sure that you're understanding collaboration versus consultation. Just review those definitions and know it. But understanding conflict resolution and change in leadership is the high level. So, knowing that negotiation is the process where there are two or more people working together for a resolution. Okay, because I need you to understand the different levels and things that you go through with conflict resolution. And when you are in leadership, you will commonly have to resolve issues, right? And then if there's conflicts, it doesn't even have to always be between people. It could be between a particular issue that doesn't involve two people, so to speak. But when we think of negotiation, that's the process where there are two or more people, that you're going to work together to come up with a resolution. Mediation is where there's a third person, um, but there's a third person utilized to kind of help resolve this issue. So it's just not two parties. You have that additional third person to help the parties resolve what's going on. Okay. And the big thing I like to talk about with change under leadership is that you have to make sure that there's a good change agent and working down the chain of command and making sure that you are explaining the changes to everyone, because that's the major issue with change. People are more apt to be flexible and work with the change if they're included in the process. But when somebody is just always coming as the leader and saying, this is what we're doing, boom, that's it. Oh, here goes the change. This is what we're going to do. And there's no inclusion, there's no discussion, there's no anything. That's where the resistance comes. Okay. So when encountering those things, I want you to think about that and say, "Hey, let's work to tell all the staff members what's going on, and let's kind of get people's feedback." And now, as far as leadership styles, authoritarian, democratic, and that laissez-faire are three common leadership styles. Where the authoritarian style are those groups are controlled, and the discussions start from the top. Like admin, and then it goes down the chain. So, an example is like military, and I say Brittany's brilliance. Think authority. You're thinking about the authority is on the top, and the instructions are going down the chain of command, right? Now, democratic, this leadership style is for more of those settings with cooperation and decisions are made as a group, like what I was talking about with the change. So that's more of a democratic team approach, right? And then the laissez-faire, this one I say is real lax. Laissez-faire sounds real lackadaisical to me. So this style lacks control. It doesn't have any direction. It's just, um, there's just a lack of structure. It's just that laissez-faire, and you want everybody to be motivated, but again, it's real lackadaisical to me. And then other terms that I like to tell you guys to make sure you familiarize yourself with: emancipated minors, understanding that these are the people that are under the age of 18 years of age, but they don't require the adult consent. So those are the ones who are married minors, those who are active in the military. Um, Advocacy. Make sure again familiarize yourself. But we talked about that with those ethical terms, right? But advocacy, as a healthcare worker, period, our responsibility is to advocate for our patients and their family, working for minimal risk in that patient-centered care, right? So remember that we are the advocates, and then also knowing that primary, secondary, and tertiary style preventions. So primary, we're doing those preventative measures, proactive measures. So I say think P for primary, P for prevention. And then secondary is the screenings, right? So I think Brittany's Brilliance, S for screening, S for secondary prevention. And then I say tertiary prevention, think that's the treatment phase, right? So again, Brittany's Brilliance, think T for tertiary and T for treatment. And again, y'all know I always say I know there's a lot of terms, but just make sure you are familiarizing yourself with these. Tomorrow, we'll have our Work It Out Wednesday questions where I will go through these and test your knowledge to see where you are with it. But then on Thursday, we're going to hit this and go through them, and we're going to repeat them. We're going to write them. We're going to read them and get that ingrained into that muscle memory, right? So make sure you're staying with me. Um, And as I mentioned in the beginning, the non-clinical series is coming to a close this week. This is concluding the month, but we will be heading into next month. All month, we're doing Work It Out Wednesday style questions. So we'll be practice question all month long. Let's test your knowledge and get you prepared for board success, okay? But as always, you guys, thank you for watching. Make sure to like, comment, subscribe, and share with whomever you may think may find this beneficial. But you make sure you meet me back here. Bye, y'all.